Ladies and gentlemen, boys and girls, welcome to the first episode of the Indian Journal of Anaesthesia podcast. Before we start, I would like to wish everyone listening, viewing this episode, a very happy New Year 2025 from the entire IJA podcast team and on behalf of the entire Indian Journal of Anaesthesia. We will start this year with the episode from the editor's desk. I have with me Dr. Rakesh Garg, the editor-in-chief of Indian Journal of Anaesthesia, who will take us through in the next 10 minutes or so what's there in the January issue of the Indian Journal of Anaesthesia and what should we be excited about in the coming year when it comes to the new research and what's he got lined up for us as special things in the Indian Journal of Anaesthesia. Dr. Rakesh, welcome to the show, and we would be very happy to kind of get our insights into what's coming up in the January issue.
Thank you, Dr. Murli Thandabavi, to introduce the first podcast for 2025. And the IJA whole team wishes everybody a very happy, prosperous New Year 2025. I'm very sure that in 2025, you all will be able to provide the best patient care, get the best research out of it, and work for the humanity in the best possible way. And continuing with this, IJA proudly announces its first issue that is usually a themed issue as the usual January issue for IJA is. And this themed issue is focused on randomized controlled trial and meta-analysis. Dear friends, as we understand into our clinical practice, we want the highest level of evidence in the hierarchy of pyramid for our clinical practice. And when we thought of the pyramid of evidence or hierarchy of evidence in this pyramidal form, the systematic reviews and meta-analysis remains on the top. It also provides insight into the various published studies into a particular area that culminates into synthesis of something called systematic review and meta-analysis. And IJA January issue is focused on the systematic reviews and meta-analysis. It is just not the systematic reviews and meta-analysis, but this issue also brings some highlights for understanding the systematic review and meta-analysis. As I usually say, and people usually ask me, that doing a research is for researchers. And I will just smile and say that research is for everybody, whether somebody is an academician, clinician, researcher, taking care of the patient, everybody should understand the research. Maybe that they are not doing the research, but they need to understand the research for improving the patient care. And this is what the January issue also emphasizes, certain narrative review from the experts, which will make us understand how to do a systematic review, but also will emphasize how to interpret a published systematic review and meta-analysis so that we can appraise those meta-analysis and we can think of whether the statements given in that meta-analysis can be brought into my clinical practice. The systematic reviews that is being published in January issues talks about the different regional anesthesia techniques on postoperative analgesia in procedures like PCNL. It also includes impact of ERAS protocols in idiopathic scoliosis for children. And when we talk of ultrasonography, why to miss a systematic review and meta-analysis? And it is a predictive value of bedside diaphragmatic ultrasonography for extubation success in critically ill patients after general anesthesia. And definitely, the pain is always an important aspect. And thus, this issue also have a perioperative analgesia efficacy of single shot SAB block versus thoracic paravertebral block in breast cancer surgeries. When we talk of neuroanesthesia, it is always a debate, in fact, an area of interest, which inhalation agents remains the best. And here comes a comparison of desflurane and sevoflurane as maintenance agent for neuroanesthesia, again a systematic review and meta-analysis. What about the fluid volume? And especially when we are doing thoracic surgeries, it's always a dilemma. And herein IJA brings another systematic review and meta-analysis, the effect of intraoperative fluid volume on postoperative pulmonary complications in thoracic surgeries. We have been very fond of adding adjuvants to our regional blocks, and there have been an array of adjuvants that are available and has been used in various blocks. Do the magnesium sulfate has a role? Let's see in this systematic review intrathecal magnesium sulfate as an adjunct to bupivacaine for infra-umbilical surgery, an updated systematic review and meta-analysis. Now, there has always been concerns when we have many drugs for controlling post-operative nausea vomiting, and we have many in the armamentarium. What to do, how to select, which is a better? Again, another systematic review wherein the authors compare efficacy and safety between palonosetron and ondansetron to prevent PONV in patients undergoing non-laparoscopic surgeries. And when we talk about the bariatric surgeries, the metabolic surgeries, there have been concerns about use of remifentanil. It has many advantages and some loopholes, some limitations also. Let's see in this systematic review the safety and efficacy of remifentanil in patients undergoing bariatric and metabolic surgery. Now, this systematic review covers a wide array of your clinical practice, starting from neuroanesthesia to bariatric surgeries to pain management to PCNL to pediatrics to ICUs. And I'm sure that this compendium will make you much wiser and probably will improve your patient care. But having said that, people believe, and sometimes I also believe, that reading this systematic review and meta-analysis is a very heavy paper. I mean, heavy in the sense it has a lot of terminologies. Sometimes we talk about heterogeneity, sometimes we talk about risk of bias assessment, sometimes we'll be talking about the confidence intervals. And just to make it easier, IJA brings certain narrative reviews for this. And this narrative review will talk about various biases. Sometimes we say random versus fixed effect model. Let's see what these are and how to interpret into your clinical practice when you read a meta-analysis. We also talk about certain things called forest plots. Many dots, some lines, and some figures. Let's understand them, what they are. And this is what we talk about interpretation of forest plot, a wood over the trees. We also talk about everything has a quality, and same would be for the meta-analysis. Let's critically appraise the systematic review and meta-analysis. Let's see whether they really have some role into my clinical practice. Why should or how should I adopt into my clinical practice? And this is what requires critical appraisal. And IJA again have another narrative review for the same critical appraisal of systematic reviews and meta-analysis. And again, in addition to this interesting armamentarium of SRMAs and narrative reviews, January 2025 issues will also thanks to all our reviewers who has helped the IJA to bring those quality articles. And it brings top 100 reviewers for the year 2025-24 who has really shaped the IJA to provide the best quality articles. Though they remain behind the screen, but IJA proudly announces their name in the January 2025 issues. Thank you so much, and I am sure that you will enjoy these. Do give your feedback, do read them, and do write comments on it to be published later on in the Indian Journal of Anaesthesia. Dr. Murli.
Thanks a lot, Dr. Rakesh. I meant to say, if I'm not mistaken, I have not seen any journal coming out with a complete issue of systematic reviews in anesthesia, at least to my knowledge. So I think this will be a very special issue. I'm really looking forward to reading it and also understanding how systematic reviews are done in detail, especially through the narrative reviews. And I'm sure in the podcast series, we will be talking to few of the authors of these systematic reviews and understanding more about them in detail as to what they understand by the results and how we can translate it to clinical practice. So thanks once again for joining and giving us a brief insight into what's coming up this month in the IJA issue. And we look forward to much more enlightening and insightful articles throughout the year from your team. And I again would like to thank from the podcast team to all the reviewers, all the people working behind the scenes at the IJA office for bringing in such quality work and making sure that the flag of our nation flies very high when it comes to anesthesia society in the world. So thanks a lot for joining us. And Thanks to all our viewers and listeners for supporting us throughout the year. In 2024, we hope to continue the same kind of quality with our podcasts, improving with your suggestions and feedback in the coming year, and wishing you all a happy and prosperous year going ahead. We will see you soon. As we always say, stay safe and stay curious. Goodbye.